Last year, I was working in the periphery of Multan as a medical officer. A young patient presented to us with a wound, with a very dirty-looking wound on the arm, and we actually, it wasn't like we could not diagnose what was the cause of that wound. We just knew that it was infected, and we thought that antibiotics would be enough, and the patient was not giving history of any trauma or anything. So upon probing further, we came to know that initially there was a rash, a circular rash, and the patient had applied a topical ointment on it after he had consulted an extended relative who had a similar condition, and he had been prescribed that specific ointment by a local doctor, and the patient did not consult the doctor, rather kept on applying that ointment, hoping that that rash would go away. And initially it did go away, but then it came again, and as the patient continued to apply it, it got worse, and eventually there was necrosis of the skin, and that led to an infected wound, and now we had to debride it actually, and give him antibiotics and the normal course that would have been taken. So basically what the patient did was that for a fungal rash, he took the common steroid creams, the betamethasone steroid creams that are commonly available in Pakistan in the medical shops, in the pharmacies. So what they do is actually in case of fungal infections, the steroids initially make it better, but then they get worse. The steroids initially mask the fungal infection, and then it gets worse. The skin becomes thin, and it can lead to necrosis, and it can actually completely destroy the skin. So just because of self-medication, this led to the wound actually, it became quite dirty, and it became necrotic. So had the patient consulted a doctor, a simple antifungal cream would have sufficed. But since the patient did not consult a doctor, so it led to this, and now the wound had to be debrided, and there was a course of antibiotics that had to be given along with a prolonged healing time.